we're going to proceed to the next question. Yes, Zainab.
Assalamu alaikum, sir. This is Zainab, and it's a pleasure to have you with us. The question I have is, what are the causes of dementia?
Right. So thank you, Zainab. That is, causes of dementia are built into the causes of dementia, the different types of dementia, as I talked through them. The cause of Alzheimer's disease, which is the commonest form of dementia, and this is the most studied form of dementia, is histological diagnosis. So when you do a section or a brain biopsy of patients who are suffering from dementia, what you see is that the cells in the brain have started becoming overloaded with a protein. They're not able to process the protein. It starts collecting in the cells. And because of the collection of that protein, the cells die. And what you see is it is commonly called plaques and tangles. So the brain cells are they are like stars with long fibrils coming out of them, and they connect to other cells. But the way tangles are reported, that they are not able to make connections with other cells, and they tangle into, they simply say they become knotted into things. And the cells which have excess of that protein, they die. And so you can see dead cells which are like plaques, or in electron microscope, you see them as filaments, like pieces of silver, and tangles. So that is the commonest cause, the Alzheimer's disease type, which is the cause of it. The second type is vascular dementia, and I explained when I was showing you the blood supply pictures that if you have a stroke, you kill off a part of the brain, so that part of the brain is now dead, or you have the furring of these small blood vessels, which is resulting into pockets of small areas being destroyed. So that is also self-destruction, but the methodology is that you're not providing them with enough blood supply. So those are the two types, main types. A mixed type is that the both functions are happening. So when you do a section, you also see plaques and tangles, but you also see damage because of lack of blood supply. The other types of dementia, one is related to Parkinson's disease, and I explained that because Parkinson's disease affects typical area, which is substantia nigra, and as the disease progresses, it starts affecting other places. Normal pressure hydrocephalus happens because the pressure in the brain increases, and it is pressing on the cells of the brain, and they start dying under pressure. The Lewy body dementia is an interesting one, and there are various theories about it. Lewy bodies are also tiny protein particles which are developing in the cells. Exactly how they develop is subject to research at the moment. And frontotemporal type of dementia is probably an inherited type. Alcohol-related dementia is related to excess of alcohol, which results in toxins being absorbed by the blood vessels, and then they die of those toxins. Again, the Down syndrome dementia, we are not sure how it happens. In the rarer forms, Creutzfeldt-Jakob disease is a prion disease. It is a virus-like particle which enters the brain cells and starts killing them off. There are various types. The mad cow disease, or the N variant of Creutzfeldt-Jakob disease, happens in younger people as well. So they have dementia-like syndrome as a young person, 20, 30-year-olds. But the normal Creutzfeldt-Jakob disease used to occur in their 60s, 70s. Huntington disease is an inherited disease, and that's the reason why it happens. We talked about the traumatic brain injury, or the disease that Muhammad Ali had. And HIV-associated dementia is also infection-related. So you basically, infection particles or HIV virus infection in the brain is destroying it. Does that answer my question, Gavin?
Yes, sir. Thank you so much. Very
Okay.
valuable information that you have shared with us. Even you shared every little cause which leads towards a major disease of dementia or different disease of dementia.